Suspend your disbelief, your rational, analytic mind, just for a minute, just for the length of this podcast. What if all I am about to tell you is the truth? What if the information you will be provided is from a divine source? Just for this time, I am your Axis Mundi. Consider this podcast your channel, your second opinion. When I do a reading, something larger than myself is working through me. So ask what you wish. This is your channel, your doorway to the divine. Oh, welcome to JohnsTarot. Welcome to you from wherever in the world you may be. Welcome to you from Ontario, Canada.
Oh, far out, man.
Welcome to you from Russia.
Try to relax. This will feel a little weird.
Welcome to you from Colombia.
Oh, the pain. The pain. Oh, the pain.
Welcome to you from the United Kingdom. Welcome to you from Poland.
Good. Latu. Barada. Nikto. Latu. Barada. Nikto.
Welcome to you from California.
That ditch is Boss Keene's ditch. I told him that dirt and it's your dirt. What's your dirt doing in his ditch?
Welcome to you from
I don't know, boss.
Pennsylvania.
Hasta la vista, baby.
Welcome to you from New Mexico.
My CPU is a neural net processor, a learning computer.
Welcome to you from, what else we got here? New Mexico, Georgia.
Oh, far out, man.
Okay, use that one again. I like that one. Welcome to you from New Jersey.
You take the blue pill. The story ends. You wake up in your bed and believe whatever you want to believe. You take the red pill. You stay in Wonderland. And I show you how deep the rabbit hole goes.
And welcome to you from New York.
I think you're some kind of deviated prevert. I think General Ripper found out about your preversion and that you were organizing some kind of mutiny of preverts.
So welcome to you from wherever in the world you may be listening to this podcast. Welcome to JohnsTarot. This is my YouTube version. I'm in a black t-shirt today. I had a little surgery today. I usually come to you in a white shirt with a vest, but a little surgery today. I just don't think I can get my arm through that white shirt today. So I'm coming to you from into clothes I'm wearing. I'm going to bring to you today a little assessment. It's going to be an assessment of patient X. Now I am an ICU nurse. I do assessments all day long. I've been an ICU nurse for 25 years. Before that, I worked in mental health as a counselor and as an aide. I had an associate's arts degree and a degree in human services and a certificate in drug and alcohol studies. And I worked for about 6 years in mental health. Then I went back to school. I got my RN license. I got an ADN in nursing and associate of science degree. And I've been working in a hospital. And what I do as a nurse is I identify symptoms, and I document them for the insurance companies and for the physicians, and I administer medications and I interpret test results, but I do not diagnose. And what I'm going to do here today is not a diagnosis of patient X, but I have identified some symptoms that really have me alarmed. So let me move over to my page. So here is my symptom page. We're going to identify this man. He's a 79 or 80-year-old male. Neurologically, he seems to have poor activity tolerance, sleeps through important events. He's obese. He's a poor historian. He is tangential. He is impulsive. He is confabulatory. He has a limited ability to concentrate for reading. He has an increased use of foul language and a decreased language fluency. He has possible sundowning, and he has a shuffling, lumbering gait. Cardiovascularly, from what I can detect, he has a +3 peripheral edema to bilateral lower extremities. His respiratory status is unknown to me. I believe him to be a non-smoker. Gastrourinary, gastrointestinal, possible urinary incontinence, has been seen wearing a urinary catheter. Skin, he seems to have scrapes on both hands, a strong indicator of falling, and bruising to the dorsal part of his hand, sometimes covered up with makeup. So who might this patient X be? Patient X is our current chief executive. Now, my first example is sleeping sleeping through important meetings. We all know he has a pretty good history of sleeping, dozing through important meetings with dignitaries, with his staff. He slept through most of his felony trial in New York. And I'm not saying that he's a bad individual for doing that. What I'm saying is he's showing symptoms. And this is a symptom. He's sleeping during a felony trial. It's not normal. He's obese. He says he's 6'4", 214 pounds. Look, I'm showing you the picture right here. That is not true. When you have obesity like that, it puts you at high risk for diabetes, obstructive sleep apnea, cardiovascular problems, hyperlipidemia. And you're wondering where I'm going with this. Wait, I have more. I say he's tangential. He says it's the weave. What it is when he starts speaking and he'll wander off a subject, wander off a topic, and then wander on to multiple topics before eventually coming back to the topic he started on. Now, he calls that the weave. In professional medical parlance, they call that being tangential. In psychology, when he says it's the weave, that's called gaslighting. So it's a symptom, but it's not because he is not because of his personality disorder. It's a symptom of something else. He's very impulsive. He has a history of being impulsive, like the tariffs. Tariffs on, tariffs off. Oh, if you put a tariff on us, we're going to give you 10% tariff. Oh, I'm going to call the tariffs off after 6 months, after 3 months. Taking the tariffs off. Oh, now very impulsive. Throwing spaghetti up against the wall when he's angry. That's impulsivity, uncontrolled impulsivity. It's not being a bad person. Again, it's a symptom of deeper problems. He has is confabulatory. What does confabulatory means? He makes stuff up. Confabulation is making things up. Remember when they asked him about Harlem? Well, what do you think? Oh no, they asked him about Harvard. He had put in some restrictions on Harvard University, and a reporter asked him about that. What about Harvard? And because it had an H in it, he went on a rambling, tangential diatribe about Harlem, how they love him in Harlem, and how the black population loves him in Harlem. That is being confabulatory. He's making stuff up. Also, he'll make stuff up. He'll become confabulatory when you catch him on a lie. When it's how about this stuff about gas is $1? Gas is $1.99. Eggs are 47 cents a dozen. Rather than being a lie, I just say that's confabulation. He's making stuff up. He really doesn't know. And I say that's a symptom. Now, I'm a limited ability to focus enough to read. He has limited ability to concentrate and limited ability to focus enough to read. That's why his, I think his Secretary of Defense, Tulsi Gabbard, has had to try to make his briefings in Fox News style. So it's all like a Fox News story. So they have pictures and talking because he cannot focus long enough to read the intel reports. That is a symptom. Using foul language, this type of thing usually comes up when somebody has a limited vocabulary. It's worse than it was 10 years ago, and that's a normal part of aging. And he'll use foul language, and that very commonly comes up with people in the early stages of dementia or Alzheimer's. It just happens. That says there, Trump speaks at a fourth grade level, lowest of the last 15 U.S. presidents. New analysis finds. So his vocabulary has been diminishing, and it's just not what it was in 2016. And I'm not saying that's bad. I'm not saying it's because he's a bad person. I'm saying that is a symptom. Here's another thing. He's sundowning. He is sundowning. He is wandering the White House at 3 a.m, sending off firing off texts at 3 a.m. about Joe Biden being executed in 2020. And Joe Biden was a robot, and Joe Biden was a clone. And because he's wandering around by himself, unrestrained and unprotected, he's really at a danger to himself when he's doing that. I'm surprised they don't have people assigned to him to protect him. But this is an example of sundowning. A sundowning is when a patient, their whole behavior change after the sun goes down. They get erratic. They tend to get erratic, a little bit psychotic, and they call that sundowning. And it's very common in the older population. And it's not because he's a bad person. He didn't go out there and say those things about Joe Biden because he's a bad person. He said it because he wasn't connected to reality at 3 a.m, and that because he was sundowning. He seems to have a shuffling, lumbering gait, especially when I looked at him after the U.S. Army parade. I saw him walking up to talk on the microphone, very lumbering, shuffling. And if you watch his gait, he tends to have that. That appears very frequently with people with Parkinson's dementia or early stage Parkinson's. They come on with a shuffling gait. They call it pill rolling. Watch his fingers. I haven't seen them do that one. They do pill rolling. They'll move their fingers like this. And I wouldn't be surprised if that starts showing up. I haven't seen that one yet. Cardiovascular. Now, this was picked out by the Irish Star, but he was at the FIFA Club World Cup. And he sat down and they took a picture of it. I have a picture of it right up here. And he has +3 edema to his bilateral lower extremities. That is an indication of cardiovascular problems or venous stasis problems. It's a problem. It's not normal. And it's an indicator of something is going on. And I'm not going to speculate, but I'm going to speculate a little farther on. It's just an indicator. It's a symptom of something is going on medically with patient X. And I'm going to get to it. I'm going to talk a little bit more about it. He has problems with urinary incontinence. And it's also been reported he has problems with fecal incontinence. Here he is. You see him, but he's obviously wearing some kind of adult diaper, some adult Depends. And here he is. You can see he has a urinary catheter. You can see it through his pants. So he's got, whether it's an external catheter or an internal catheter, I cannot tell. But he's obviously wearing a catheter of some sort of urinary catheter. Now here's the one about the bruising with the hands. Now this is easier to describe. He was probably getting some type of blood test from the hand. I see this often in the hospital. So they were getting a blood test from the hand, and if you're on blood thinners such as warfarin, Pradaxa, Eliquis, Xarelto, Plavix, you get this huge big bruise if they're not really good at what they're doing. Normally, if you're not on blood thinners, you might get a small bruise, quarter size, nickel size, but this covers the whole dorsal part of his hand. So he is obviously on some kind of blood thinners. Now, why would you be put on blood thinners? Well, you get put on blood thinners if you have AFib. So it prevents thrombosis from forming and you getting a stroke. You may be put on blood thinners for if you had a history of pulmonary emboli, PE, or you might be put on blood thinners for TIAs, if you have a history of TIAs, transient ischemic strokes. Transient means they only last for a short period of time. Does he have that kind of problem? There are indicators that say he does. Now, when I look at the bilateral lower extremity edema with the use of blood thinners and the bruising, I am more inclined to consider it to be maybe a combination of things, but he has cardiovascular problems without a doubt. And here he has a picture of it with his hand. Now, you're saying, you're kidding. No, I took these, no, I'm not kidding. I took these symptoms, all these symptoms from the first list, and I put them into an AI search engine, and a commercial, free to use AI search engine. And I said, given a person with these symptoms, please provide me with a differential diagnosis. And this is what came back from AI. It says neurologic, psychiatric. Again, this is not my diagnosis. This is coming from AI. So they give several examples. The one I seem to like the most is frontal temporal dysphagia, because it says it matches impulsivity, use of foul language, poor judgment, executive dysfunction, especially if memory is relatively preserved. Other than that, it's also talking about Alzheimer's disease, common in this age group, poor memory, confabulation, tangential speech, poor insight, decreased fluency, limited concentration, vascular dementia supported by shuffling gait, obesity, cardiovascular disease, and +3 edema suggests poor perfusion or chronic vascular disease. And Lewy body dementia could explain fluctuating attention, impulsivity, possible sundowning, gait changes, but usually includes visual hallucinations, which I did not mention because I don't know if he's having them, because I have not personally assessed this patient X in person. Cardiovascular, AI says cardiovascular, metabolic, congestive heart failure related to his 3+ bilateral lower extremity edema, poor activity tolerance, and obesity. Suggests right or biventricular heart failure, possible overlap with cor pulmonale or chronic venous insufficiency. And also, AI also picked out he has chronic atrial fibrillation or other arrhythmia, which can cause fatigue, reduced activity tolerance, possible thromboembolic events, strokes, TIAs, which could be underlying the gait and speech deficits, previous stroke or lacunar infarcts, as indicated by his shuffling gait, poor fluency, cognitive defects, may reflect past cerebral vascular injury. Other important considerations might be a normal pressure hydrocephalus. He has the classic triad, a gait disturbance, cognitive decline, and urinary incontinence. His gait or shuffling is reversible caused by dementia. He may have delirium superimposed on dementia, especially with sundowning or waxing and waning symptoms. Could be triggered by a UTI, wearing a catheter, dehydration, or medications. When it comes down to endocrine, metabolic, AI says obstructive sleep apnea, OSA, related to his obesity, daytime somnolence, poor memory, obstructive sleep OSA, obstructive sleep apnea, is very underdiagnosed in the elderly and worsens cognitive performance. Uncontrolled diabetes or hypoglycemia, especially if there are unmonitored episodes of confusion or fatigue, could contribute to vascular dementia and neuropathy. GU and falls, urinary tract infection or chronic retention, possible source of confusion or delirium. Indwelling catheter increase your risk. Recurrent falls. I thought I had a picture of that where he had his hands up and he had dots on both hands. And that is usually an indicator of a red flag for possible elder abuse. I don't believe there's anything like that going on. If anything, I think it had to do with falling. And if you're on blood thinners and you fall and you take a head injury, it could be critical. That could end somebody's presidency. And it talks about evaluating for neglect or abuse, especially if explanations are inconsistent. So AI's top summary of likely diagnoses: mixed dementia, Alzheimer's, and vascular, because it fits the cognitive and gait symptoms with a vascular disease. Frontotemporal dementia, because it fits behavioral changes, language, and impulsivity. Congestive heart failure, cardiovascular disease, explains edema and fatigue. Normal pressure hydrocephalus, because he has the triad of a gait disturbance, cognitive function decrease, and incontinence. Delirium from UTI or meds. We know he likes modafinil and Adderall and those types of things if symptoms fluctuate or recently worsen. Obstructive sleep apnea or metabolic syndrome, contributing to poor cognition and fatigue. Now, I tell this story. I got up here and I did this today, not because I am angry or I am just hateful. These are real symptoms that patient X is suffering. And at the end of the day, he's only a man. He's an elder, aging, older man. And he is subject to all the ravages and infirmity of time, just like me, just like all men, just like all human beings. He is not able to escape time or nature. He's not a God king, not a Superman. He's not immune. He's just a man. He's just a man, just like me, just like you. And he's subject to all the things aging human beings are subject to. And that's all the things I'm discussing. I was very anxious about doing this because I worry about the consequences. When I did the initial, I did this in the morning before work. I put all this stuff together, and especially when I ran it through the AI program and I came up with a detailed description of his possible medical problems, I was really concerned. But I have to do what I believe is right, and telling the truth is part of doing that. Our chief executive is a rich and powerful man. I am not. Our chief executive has unlimited resources. I do not. I have only my observations of the truth and my integrity. And at the end of my life, at the end of every man's life, that is all that matters. Does a man have integrity? Has he lived a life to be proud of? Has he done his best and have no regrets? And he is not immune from the ravages of time, age, and growing old. It's a natural process, and it happens to us all if we're lucky enough to get that old. Let me move over to my tarot cam. There we go. And tarot cam. So we're going to do a little tarot reading. How'd I do here? 23 minutes. That's pretty good. That's not bad. So my ability to read tarot is a gift. It's an expression of divine love, and I'm here to share it with you in that same spirit. And I am not going to ask about patient X's health. If you want a real good, psychic reading on that, Mary Ann at Guiding Light Tarot, look her up on the internet, and she did a really good psychic reading on his health, and it didn't point to a very promising thing. And as I look at patient X, I am concerned for his health. I know he has the best doctors, and he's receiving the best medical care that's available. He's also had COVID. I never had COVID. I worked on a COVID unit, and I didn't have COVID. It's got to have respiratory problems. When I see long-term COVID patients, they have mental problems, cognitive problems. It just seems to figure. It just seems to figure that patient X is not the perfect specimen that he claims to be. So let me shuffle a deck. Well, what I'm going to ask, I'm just going to do a quick reading. One quick reading. And I'm not going to ask about patient X. I'm going to ask about me, my favorite topic. I'm going to ask, what do you think about my assessment of patient X? What do you think about my assessment of patient X? Let's see what we get. I'm going to use the standard Rider-Waite cards. I'm always interested to see what I get. The five, the Five of Swords. The next card. I'm just going to do a simple 3-card reading and wrap this up. Now I'll throw some runes on it. The Ace of Swords. And then, the 6 of Swords. Let me throw some runes on this because it's a pretty straightforward reading for this guy, for patient X. And I'm going to have to go along with Marianne. I think he's in some trouble. Odin, for him, to help guide this reading for the 5 of Swords. And my rune is Elgis. And for the Ace of Swords, my rune is Radio. And then for the 6 of Swords, I shouldn't even have drawn the runes for this one because it's straightforward. It's Tiwaz. So in the reading, and remember the question was, what do you think about my assessment? About my assessment and the things I just talked about. And you see the 5 of Swords. You see a man with a green tunic with swords on his shoulder. And this has to do with, this is not going to be a very popular video. And a lot of people are not going to agree with me. But I need to have a thick skin, as evidenced there by the green tunic. And I need to keep my swords of truth close to me, close to my chest. And that I should try to avoid controversy and realize that I have the truth. And the truth remains, the truth is the truth. And I know the truth, and I talk to you about the truth. And it's not going to be a popular version of the truth, but it's the truth nonetheless. Elgis has to do with, that's the hunter, and it has to do with going on a journey and not being fearful. Good, because I was kind of scared when I did that AI reading on him, because I've been a little fearful about that. And not to be fearful of the hunts, that you'll be protected by forces that are outside of you. The Ace of Swords has to do, you see a hand coming out of clouds with the swords, and a wreath on top and a crown, and that has to do with truth, has to do with justice, has to do with winning in legal disputes. The crown has to do with being a leader. And also you have the wreath falling off of there, and that has to do with, again, success. And then the rune is Radio. And that has to do with travel. Sometimes travel does not necessarily mean travel on the roads. It means a spiritual travel. It could be a travel of perception. It could also mean you're on the right path. So I'm telling the truth. I'm on the right path. And then the 6 of Swords. You see a man on a boat, on a skiff with a woman, and he has swords sticking up, and he's taking this woman across the river. That has to do with somebody who has skills and abilities, indicating me, that is able to help people in times of trouble. And that these are not normal skills and abilities, but special skills and abilities that help people in times of trouble and help move them across the river of difficulty or of misunderstanding. And the rune is Tiwaz. That is the warrior's rune. That is a successful campaign by a warrior. Warriors are very strong and very, what can I say, aren't really fearful, but also warriors understand they're not in charge and they're waiting on the will of the divine. And it's ultimately that will of the divine that controls everything. So I'm going to, what do you think about the reading?
Oh, far out, man.
Oh, well, I'm glad you liked it. So for today.
Goodbye, Professor Marvel, and thanks a lot.
Why, it was my pleasure. I will post again on next Tuesday on the podcast only, on the verbal only. If you would like a reading, or let me know and send me an email and like that, and we'll set up an appointment for you. Also, if you're writing me from Russia, some people are watching me in Russia, and I'm getting some emails from over there. Send emails in English so I know it's from you, and I'll be happy to talk to you and answer your questions. I have a Facebook page called John's Tarot. So if you like to, this will be up there on John's Tarot. If you'd like to leave me a message on John's Tarot, you can do it there. If you would like copies of my assessment, I did the assessment and the AI differential diagnosis. Send me an email and I will send you a copy of both, free of charge. No charge. I'll send you a copy just because you listen, and you can assess it for yourself and take a look at it. So until next week, be careful, be cool, be kind, and remember, find courage, have faith, and I will see you all again. I'll talk to you all again next Tuesday. Okay, bye-bye.